I'm Rod Rourke. I'd like to welcome you to this edition of the PRS Journal Club podcast with your hosts, Drs. Jordan Frey, Chad Purnell, and Dr. Shuja Shafqat. Please enjoy.
Hi, and welcome to the August 2017 edition of the PRS Journal Club podcast. I'm Chad Purnell, PRS Resident Ambassador from Northwestern, and I'm joined by my co-ambassadors Jordan Frey from NYU and Shuja Shafqat from Lehigh Valley. Today we have the honor of being joined by Dr. Michael Zenn, former professor and vice chief of the Division of Plastic Surgery at Duke University, now in private practice in Durham, North Carolina. Thank you very much, Dr. Zenn, for joining us for this podcast.
It is my pleasure.
The article we'll now be discussing is Male to Female Sex Reassignment Surgery Using the Combined Technique Leads to Increased Quality of Life in a Prospective Study by Drs. Papadopoulos, Zavlin, Lele, Hirschbach, Heinrich, Kovacs, Ehrenberger, Machens, and Schaff from Munich, Germany, and Cornell. As a quick reminder, all the articles that we will discuss can be read for free on prsjournal.com, including an archive of all past Journal Club articles. So just as a quick intro to this article, gender dysphoria is becoming more commonly recognized and more commonly clinically treated, and its prevalence may be much higher than we have initially suspected. And so the authors have a good deal of experience with sex reassignment surgery, and they set out to determine quality of life changes in male to female transgender patients after their technique of two-stage vaginoplasty. The study is designed as a prospective cohort study. They initially enrolled patients prior to undergoing their vaginoplasty. These patients were given a set of questionnaires at the first time point, which was 1 day prior to their first surgical stage. Then the second surgical stage went on 6 months after the first stage, and then they were given a set of questionnaires 6 months after that second stage. So the mean for the second time point for the survey was about 11 months from the first surgery. The technique is not completely described in this paper. They actually refer you to a paper that they're going to be submitting soon on their technique. But basically, it's a two-stage creation of a neovagina. And how they do this is the first stage is a penectomy, orchiectomy, and a dissection of the urethra in the first stage. And basically, they're using both flaps and grafts to reconstruct the neovagina. And their technique is not a penile inversion, which they are careful to note. The second stage, which is performed 6 months later, is more secondary cosmetic adjustments, such as a scar revision or the removal of a dog ear. Unfortunately, you can't completely understand the technique because they don't have any illustrations and they haven't published their technique yet, but I'm looking forward to whenever they do. The questionnaires that they sent out were, first of all, a questionnaire on demographic data. Then they had the German language questions on life satisfaction, which is a standard satisfaction score in Germany, which includes general satisfaction, health satisfaction, and body image. They also sent out the Freiberg Personality Inventory and the Rosenberg Self-Esteem Scale, and then finally a patient health questionnaire. The results that they found were their mean age of patients was 38 plus or minus 12. And this is a bimodal distribution. A lot of patients in their mid-20s and a lot of patients in their late 40s. These patients had lived with a female identity for a mean of 3 years. And also in Germany, all of these patients have mandatory psychotherapy. And this is state-sponsored, and patients had undergone this for approximately 28 months. However, they're careful to note that only 24% of patients were actually attending after they had had their second surgery. So a lot of patients had either stopped their psychotherapy or they had graduated from it. 87% of the patients had 2 or more surgeries during the study period, including 46% of patients having a breast augmentation, which I think is an important confounder in this study. The results on the life satisfaction portion of the questions on life satisfaction, patients noted higher post-op scores on hobbies, health, and partner relationships. However, the income and family life metrics on this test were still lower than average at both time points. On the health satisfaction section, patients noted an improved ability to relax, improved energy, improved mobility, and improved freedom from anxiety. All of those were statistically significant. However, most of these were below average to start and then improved to either normal or better than normal afterwards. On the body image section, I'm not going to go through everything that they went through, but overall, patients scored 7 of 22 items, significantly higher post-operatively than they did preoperatively. Looking at the Rosenberg self-esteem scale, this is basically a measure of self-esteem. There was a significant increase in postoperative self-esteem. This actually improved to better than the mean for the German population, and patients started about similar to normal for the German population. And then finally, on the patient health questionnaire, they noted mild depression and anxiety preoperatively, and after surgery, this had improved to similar to the normal for the German population, which was a significant decrease postoperatively. In the discussion, the authors discussed that overall satisfaction with their procedure and also quality of life improves with their procedure. However, they do highlight that overall, the general and health modules in trans patients in a previous study were actually lower than normal 3.2 years after surgery in a prior retrospective study that they performed. However, that study also had a lot of confounders because it included both trans men and trans women. And so this study in particular had much more stringent inclusion criteria and also was prospective. So this is higher quality data than their previous study. In general, this study has a shorter follow-up, but is just overall higher quality. I thought that the authors really should be commended. It is hard to design and execute a prospective study, and I think that they did a really nice job designing this study, selecting comprehensive metrics so they can look at a lot of different aspects of quality of life in these patients. I do think there were some problems with the study, namely that there were some confounders, with 46% of patients having other types of surgery, such as breast surgery during this time. We're not looking at just their improvements from their vaginoplasty, we're looking at improvements from all of their surgeries overall. But I do think studies like this really are essential. One, because gender reassignment surgery is really a cutting-edge field in plastic surgery. And I think as there's a debate amongst insurance companies of whether they will or will not cover this, I think it's really important that we perform studies like this so that insurance companies see that there are improvements in quality of life. And then otherwise, I wish we could understand their technique a little bit better, but I'm awaiting their technique paper and hopefully a long-term follow-up to this study to see what improvements remain in the long term. With that, Dr. Zenn, I'll turn it over to you. What did you think of this study?
Well, first of all, I thought that was a great synopsis of the article. There's just a lot of stuff going on here, and I'll be the first to tell you that this is not an area of expertise for me. So anybody who is listening who would be an expert certainly would have a lot of comments to make as well, like you're saying, even technical things. You know, these things are so important. I tell you, I've lived through a period of time where even something as simple as breast reduction, where we know all patients benefit from it, there were no studies that showed there was actually a benefit, you know, from the psychological side. And so these have become very commonplace. So you guys are training in a period where we have the breast Q and the face Q and the cleft Q and all these things. And they are really important because you need to show that these are worthwhile surgeries. It's not something that's cosmetic. Something that impressed me in the paper was the comment made by one of the articles. He's saying that these patients, they're not trying to get the most beautiful, perfect bodies. They just want to be female, you know, and I think that's something that really struck a chord with me because I don't have a lot of experience with these patients. And, you know, you can see how an insurance company might write this off as cosmetic surgery, right? I think that one of my issues with the way they went about this is they don't really have a defined tool to look at gender reassignment patients, right? So they kind of took a whole bunch of indices and measurements. And in fact, if you look, some of them, they actually just picked out certain questions. They didn't even give the entire 138 questions that are required. They picked out 8 questions, just the ones they're interested in. And as you know, that's probably not a good way to go about looking at some of these things. But I don't know, I thought 46%, you said that's a confounder. Were you surprised by that number? That men who have gender transformation to females, wouldn't you think that number would be higher?
I was actually surprised in 2 reasons by that. One reason was because 46% having breast augmentation I assumed would be higher, but I was actually surprised that most patients hadn't already undergone that because, you know, typically I think that breast augmentation is usually performed before a vaginoplasty. And so they may have just a different pathway at their institution as how they go through the timeline of surgeries for gender reassignment.
Exactly. And that brings up the point is that we are looking at a study in Germany. So it's a little different. Cultural norms are different. It's not unusual that the Europeans are doing things, you know, and they're accepted that aren't necessarily accepted here. The fact that everybody gets covered under German healthcare, obviously not the case here. I do agree with you also that, we're looking at this one technique, and, what if that technique is shown to be not as great a technique as perhaps, a penile inversion or something else, and, you're only looking at patients at a year, right? And I think the study that you pointed out was that 3 years people were unhappy, and you can imagine sort of after getting over the initial satisfaction of, not having a penis and now having a vaginal vault and things like that, but then not being happy with its actual function. So I think that there was a comment made that the amount of sexual activity increased significantly. I think it said to 57% from like 16% or something like that. So all these things are positive. I don't think anybody here in the group is surprised that these indices went up and were positive, that people were happy and it changed their life. And that's plastic surgery. That's what we do. Sometimes, it's just hard to get people to pay for it, right? And get insurance companies to pay for it. And that's going to be our challenge going forward. There's limited healthcare dollars. And, as we get healthcare for everybody, we have to decide, do we want to pay for everything? So these studies are done to try to get health insurance, to pay for them. But, if there's not enough dollars around, how do you decide? Talk about things like face transplants and things like that. It's like, these are things for people who are really deserving, but can our society afford to pay for these surgeries? So right now they're unusual surgeries, and many, many residents I talk to who are looking for jobs and trying to decide what they want to do are interested in this type of surgery. And so I think for you guys who are about to go out and embark on your career, there's a lot of space right now for you to develop this into something real. And so I think it is worthwhile. I think patients get an incredible benefit from this. I think obviously it's something that plastic surgeons need to do and not other specialties. And sometimes in our country, there's more GYN docs who are doing more of this than plastic surgeons.
Yeah, and I think as plastic surgeons, we really need to own this, or else this is going to be something that other specialties will take over, because there's clearly a patient desire for it. And if we don't do it, someone else will. So I think it's important to learn how to do these surgeries and be familiar with these surgeries. That actually transitions into a question that I wanted to ask you, Dr. Zenn, which is a lot of residents don't necessarily get exposure to these kind of procedures, but as you mentioned, they're interested in these. What do you think is the best way for residents to be educated in these types of procedures? Do you think that doing a fellowship in transgender surgery is the best way? Or do you have any other suggestions for people looking to learn these techniques and utilize them?
One of my graduating residents last year was interested in this, and I can tell you there's not a lot of fellowships out there. So I think the problem is you're not going to see enough of this surgery in your residency to go out and just do it. So I look at this like any highly specialized procedure, that we need to have some sort of fellowship type system, but really a center of excellence type system where people having the surgery are having it done by people who do it all the time and have this sort of center of excellence mentality where there's psychosocial support and everything else that you would need. Going back to sort of we have to own this, I think that's a great point. Oftentimes in plastic surgery, we get cut out of things because we're not the gatekeeper. We're not the people who see the initial breast cancer or the initial head and neck cancer. This particular patient population, we actually, as was mentioned, I think by Chad, is that we actually see these patients and actually come to us first. They come to us for frontal bossing and for breast augmentation and for liposuction and things like that. So I think there is an opportunity for us to own this and be the gatekeepers for ourselves.
Yeah, I think that's a great point. Jordan, what did you think of this paper?
I thought this was an interesting paper. I was interested in it. We're NYU starting to do a lot more of these procedures, and I think as we look at our outcomes and then have been looking kind of in the literature and what's out there, the one thing, as with a lot of areas of plastic surgery, but especially in transgender surgery, as more is being done, is a lot of the outcomes data is very heterogeneous. A lot of the outcomes that are looked at, people place varying importance on various aspects, and if they are doing or examining patient outcomes, a lot of it is just kind of surveys that are developed for that particular study are not necessarily validated or universally available. So I think this is obviously imperfect, but the authors were doing their best to try to look at some objective and validated surveys, if not validated necessarily in the transgender population, then in the overall population. So I think it was interesting, and Dr. Zenn, you were saying that this is something that we're seeing, that these patients are being helped by these procedures, so it's good to see those borne out in the results. But I think looking at almost developing sort of a transgender Q or something like that would be an interesting thing. And I was just wondering if you could just speak for a moment the importance in transgender surgery, having a validated study like that, and kind of in all of plastic surgery as outcomes are moving towards, importance is moving towards examining patient-reported outcomes.
Yeah, I think this is almost like a business approach to healthcare is where do you spend your dollars, right? So you want to spend your dollars for the greatest benefit. And, how do you measure that, right? And how do you measure the quality of life issues? And we know it can be done, right? And I think this is where people like Andrea Pusick have really helped our specialty immensely by really starting out with something like a breast Q, which really helps to validate and is actually now a standard that insurance companies and people publishing data, if they want to prove that their actual data has some meritorious aspects to it, that they actually can do this and we believe it. So you can imagine that really we should probably have it for almost everything that we do. And then we potentially could figure out, well, this procedure is expensive, but look at the incredible quality it adds to someone's life or the years of quality to their life. And that's huge. Was anybody surprised that the patients in the study only had female identity for 3 years before they had surgery?
That's a good point. That is something that's kind of striking. You'd think it'd be, potentially a little bit longer. I'm not sure. They don't say necessarily how they assess that.
It seemed rather short, and the psychotherapy was basically 2 years. And I was thinking to myself, I don't know what the magic number would be. I don't. We always feel like people live with this issue for their whole life. But this tells me that maybe that's not the case, and maybe they didn't identify sort of well enough what they meant by that. Because you're not operating on people in their 20s necessarily. I mean, one of the patients in their study, I think, was 60-something years old, or almost 70. It's 38 plus or minus 12 years. So I don't know. It's surprising. And I think the value sometimes of these studies also is that it really educates us, the physician, because we really don't know anything about this population, unless your practice happens to be based in it. And we apply all the normal standards that we do to just our other patients. But there's a lot to be learned, and certainly just because we do a surgery and we think we're going to change somebody's life, that's not always the case. You'll find that from reconstructive surgery to cosmetic surgery, that people can't necessarily solve their problems by having surgery. And I think this is something different, and I think insurance companies should look at it differently.
Yeah, those are some great points. Shuja, what did you think about this paper?
Thanks, Jordan. I agree with what everybody said. I think it was a very well done study. Like Dr. Zenn said, there's a lot of numbers, there's a lot of surveys that they did, so it's easy to get bogged down by those. But I think that they kind of did a good job of showing what they wanted to show, which was basically showing that these patients have improvement. And like Dr. Zenn mentioned, it's not cosmetic surgery. These patients do have some degree of improved quality of life. And I thought it was interesting when you mentioned having one of these validated surveys for almost everything we do. Certainly a lot of things that we do aren't necessarily life-saving or limb-saving, but something that's improving people's quality of life. And those ones, I think, really benefit from having that validated survey to show that they improve patients. I think that, not having the exact technique was I agree with Chad that it may confound things a little bit, because I wonder if some of their results were a factor of their specific technique rather than kind of an overall assessment of all outcomes from this procedure from multiple different ways. I also agree with Dr. Zenn. I think that there is a little bit of a short duration of female identity for these patients at only 3 years, especially because they had a bimodal age distribution. A lot of these patients were older, in their mid 40s. So I was a little bit also surprised by that. But overall, I think it was a good paper. So kind of on the flip side of this, and not necessarily looking at how the patients are improving after surgery, but I'd be interested to hear what Dr. Zenn thinks about, do these studies play a big role in helping these procedures gain societal acceptance, either amongst patients or amongst the public, as this becomes more of a topic that's in the minds of people and in the media? Do you think that studies like this really show that there is some benefit to this and it isn't, like you said, a cosmetic procedure or something that's not really helping people?
It's a good question. It's really hard to know. Obviously, people aren't reading these types of journal articles, right? So who is? It's educating people like you and me. Can that make a difference? Absolutely. I think so. I think, I've had plenty of patients who come and they say they're so happy to see me because their doctor said they would never, ever do this, or this was dangerous, or, talk about almost anything we do microsurgically or anything else. And it may be something you do routinely. It's not a big deal at all. So I think the more educated physicians are, certainly, the more we can certainly help direct patients and help direct them to get covered for procedures like this. If someone came to me a few years ago and said, I was interested in this, I wouldn't even know who to refer them to. And I would say, sorry, or they wouldn't even get into the office, And keep in mind also, we don't even know what the actual incidence of this problem is, right? So, it becomes, is this a really small problem? It's probably a bigger issue than we think. It's hard for people to step forward. So certainly the more it's accepted by the medical community and the medical community can feel comfortable with it, I think it can certainly help its acceptance. For the lay public, that's where maybe like a Bruce Jenner or something like that would be more helpful. It's like the Angelina Jolie effect. And I know it's crazy, but that makes a bigger impact oftentimes than journal articles.
Great, thank you.
I think that's been a great discussion, and I think with that, we'll end our discussion of this article. Remember to tune in to the other 2 articles that will be discussed on this month's podcast, as well as the PRS Journal Club podcast that will be broadcasted every month. Also, don't forget to participate in our monthly Twitter #PRS Journal Club, where we will be able to interact directly with this month's selected articles authors. And thank you again, Dr. Zenn, for joining us.